Good morning, everybody. So we have had some great talks this morning, and I think that, inadvertently, I think this is a good way to end this because it gives a prelude also into our conversations for this evening. Because as we all know, as public health practitioners, that it's the policy level that has the most sweeping change, right? So I want to give a brief talk on some different toolkits and framework, because we love framework in public health going forward, and how do we establish these more diverse and equitable and just academic institutions. So as she said, I'm a physician assistant, I'm a PA, practicing in family medicine, but also I am a public health practitioner as well with a focus on health equity in historically excluded populations. So I'm an old country boy from Louisiana originally, so I love giving analogies and stories. So picture it, Golden Girls. Picture it. We are traveling down this road toward anti-racism because we're not there, right? I don't think anyone can honestly stand up and say, I am anti-racist. We're on a journey together toward anti-racism. So this road symbolizes that journey. But also imagine a car on that road, and we're all in that car together, and we all are going toward the same direction. Do not feel bad if you pull over on the side of the road and let people out along the way who do not need to be in the car. So I always want to say, make sure that this work is meaningful. Reflect back on the transactional model, do your primary appraisal and secondary appraisal to see where you need to go and what kind of coping mechanisms you may need along the way, because it gets hard sometimes. So I wanted to today talk about some sample frameworks and some available toolkits that are out there that will help us advance anti-racism and DEI in our academic institutions, as well as discuss some strategic as well as some intentional opportunities toward anti-racism as it relates to our policies and our institutions as a whole. So in this, I want us to be dynamic. So we can't be static in this work. We have to move and groove and change and shift focus from time to time as different things happen. We do not live in a bubble. We live in a world that's constantly changing and things are going on around us. So, a lot of our work here lately has been in anti-Black racism because, we all watched George Floyd be murdered. We all watched Breonna Taylor, we all watched Ahmaud Arbery, all these things that we cannot ignore. And sometimes I say the pandemic was a blessing because we could not turn away from the things that we once were able to turn a blind eye to. Be collaborative. A lot of times you will be assigned this alone, but we can't go at it alone. So I'm thankful for all of you who are here in person and online, because it does take a collaborative interprofessional team in this work toward anti-racism. Again, this goes back to being dynamic, but being flexible in order to change focus and shift focus and be intentional. Because everyone, I say, will have their day in the sun, but we have to make sure that we are focusing on one or a couple of issues, but giving our full resource and attention there so that we can have sustainable change. So one of the ways that we do that is look at the social ecological model. We're at the top. We're looking at the policy level. So we want to make sure we're reviewing existing policies through what I call a JEDI lens. I had a good conversation with someone last night about our term JEDI, which is justice, equity, diversity, and inclusion, and looking at it through an anti-racist lens. So every time I'm reviewing policy or we're looking at handbooks and different procedures, I put on my JEDI hat, I say, okay, let me look at this critically through a JEDI lens. And so at the University of Washington, we have this equity impact tool of how we review different policies and procedures. So you can use this actually in creating policy and procedure, but also in really just dissecting and seeing how do we need to change or do we not need to change. I will say we went back here recently looking at our policies and procedures in the Department of Family Medicine, and they were last updated in the 60s. So you can imagine, right? So this is some ways on how to critically appraise your policy. So look at the scope. Really look at who are the stakeholders, and also who needs to be at the table when we are coming up with these policies and procedures. Like, who is it about? Because, one thing we talked about community participatory research, you can't really do it without knowing and involving those that it's going to affect. Look at how you will assess equity and the community context. In family medicine, we always say, we're a profession that's rooted in the community. We're change agents. It's rooted in social justice. We're a counterculture. So I always say we need to renew our social contract with the communities. And so throughout even academia, your stakeholders also are the community members. And so what voice do you need to hear? What voices are being represented? What's the impact on known disparities of the community? So if you go in blind and don't even know the disparities, it's kind of like just throwing spaghetti against the wall, right? And just seeing what sticks. And then in that, too, is very important as academics and in academic institutions to look at and analyze the analysis of the decision-making process. So again, prioritizing the community, also evaluation. So when we do these things, we want to make sure that we have measurable goals and outcomes so that it can be sustainable, so we can know, are we actually moving toward anti-racism? And then make sure that you have a purpose, as well as look at any adverse impacts that the policies and procedures may be putting forth. So ask yourself, who could be negatively impacted by these policies and procedures? I will tell you, I'm going through promotion and tenure right now, and some of the things that are meant for good are actually negatively impacting me because I am not able to tap into my network of people who do Jedi work because they're saying they're too close to me. But I tell you what, I'm a black man in medical education, and we know each other, and we support each other, and people are propping me up from time to time. So you telling me I can't use these people? So I'm having this back and forth pool right now because of some policies and procedures that are in place. Look at how do we advance anti-racist alternatives and how do we implement them? So again, looking at the anticipated positive impacts, not only just the negative, but how can it be positive? And then also, again, that you see the word communities again. We have to make sure that we are rooted in the community to make sure that impact is equitable there. And then just doing ongoing learning and engagement. So it's really a performance or a continuous quality improvement project. So that is one way that we have been looking at the impact of equity when it comes to our policies and procedures, but also so you can use this framework to also create different policy and procedure. And so, a lot of times we don't, this work is hard and we don't want to just reinvent the wheel all the time. So I want to offer some existing frameworks or toolkits that are out there, but also, you can feel free to develop your own. But this is one that our PA Association has come up with. So the Diversity and Inclusion Mission Advancement Commission, which I chair, a couple years ago we developed this DEI toolkit as well as some best practices. And so it's really just a step-by-step, which can be personalized for your organization as well. So number one, we have to make sure we define goals and objectives. So this kind of sounds like program planning, right, and health interventions. So define our goals and objectives first. Then make sure you go to your implementation strategy. So coming up with, okay, how are we going to design this and how are we going to make sure that we push it forward into the community? And the step 3 is after you come up with that, you want to make sure that you begin the implementation. So this is really just a continuous loop of quality improvement. And so that's that way of being dynamic and being flexible too, because anywhere along the journey, you can always go back to the previous step. So begin the implementation. Step 4, you want to make sure you start gathering the data and then come up with an assessment plan. Then move on to step 5 to make sure you have your discussions and the reports, send them out there to show, okay, this is what we did, this is how we changed toward a more anti-racist system. Did it work? And then based on the data and what you have assessed, make improvements. So, if it worked, great, but you still want to monitor it. So you look at it through a continuous feedback loop of process improvement. So this is one roadmap that we have out there that's available, like I said, that can be customizable to different academic institutions. This other one is called the CARES framework that I worked on with a group of PA educators to come up with how do we cultivate an anti-racist environment, and we offer some strategies and solutions. And so we call it the CARES framework because you in this work. It does take heart, and you definitely care. So we say we have to look at the leadership structure. So you got to start at the top. Look at the leadership structure. Are these people on board? You know, you've heard of, assigning duties to different committees, assigning a task force, but what are the tangible resources that are given to these task force? And do they actually care about the result that is coming out? Or is it more so of, well, we're doing it, so we check that box? So leadership structure, and what is the composition of the leadership structure? Is it diverse? Is it homogenous? Does it have diversity of thought? And then also implementing climate surveys and culture surveys, and just to see where we are, looking at inclusive surveys or surveys of belonging as well. And then the big one is admissions. So in higher education, we are the gatekeepers. We can either choose to keep the door closed or we can kick it open. We can choose to take the elevator to the top and stay, or push the button and send it back down. And so admissions is very important. So the buzzword now is holistic admissions, right? But are we really doing that? Are we removing barriers? Are we looking at applicants through a lens of equity, through a lens of justice? Do we recognize that someone who has a 3.2 who works 40 hours a week actually shows that resilience and grit that we're looking for, besides the person with a 4.0. So admissions is key because we are the gatekeepers, and we choose to open it or keep the gate closed. A curriculum, so that was mentioned earlier too. So looking at curriculum, how are we incorporating anti-racist pedagogy? How are we incorporating structural competency into our curriculums? And also teaching history. So I teach racism and medicine topic at the University of Washington, and we do a timeline just as you kind of saw here, and we start 1609 and go through present day. Some people get it. Some people don't. I kind of got triggered when we were brought up about the feedback from students. You would be surprised at the things that I've seen and read about me. That as a part of policy and procedure, everyone else has to read too when I go up for promotion. So it's those things. I tie that back to the policy. Looking at performance metrics, so again, measuring what the changes that we have implemented and how are we doing when it comes to the performance. And then really assessing the environment as well as the level of social support that is present in our academic institutions and in our classrooms, and putting up an accountability structure that bad behavior and racism is not gonna fly. That is usually the lay of the land is if you report something, you're usually the one that's vilified, right? So we have to have some accountability structure. And then communication styles too. I always call my voice, I say I talk in this raggedy voice, but I pride myself in speaking AAVE, African American Vernacular English, and so my communication style might be different than someone else's, right? I'm not gonna code switch. I'm not gonna speak whatever you deem to be the correct way of English. So learning different people's communication styles too, being that verbal and nonverbal. So this is the CARES framework, which can actually be used and customized for your academic institution too. And so here are some action opportunities while I close. So create and implement anti-racism educational interventions. So utilizing the toolkits like I just showed you. Implement anti-racist pedagogy. So this is a pedagogy that is really rooted in critical reflection. Neutrality is not allowed. So you can't say, I don't see color, yes you do. Understand, and then really understanding the roles of oppressive power structures. And then we want to really move beyond cultural competency because, especially in medicine, we always say, I'm a culturally competent provider. Actually, no one's ever can be culturally competent. So I think that's a misnomer. So you don't get a badge. It's not a one and done. So it's actually you're being culturally humble and you're on a journey toward cultural competency. But just replacing that with more so structural competency. So it's really looking at the overall system, the complex social and environmental, as well as the economical structural factors that are actually influences people's lives and people's existence and how they show up in your academic institutions. And then, again, looking at policy statements, creating policy statements, revising or creating new admission practices that demonstrate the institutional, so from the highest level, their commitment to JEDI as well as anti-racism. And then, again, we like visuals, so creating visual dashboards and that show the outcome data as well, so people can see, oh, this actually works, and how do we sustain it? And then, again, given the time, giving people funding, and make sure that there are expectations around the job that regards structured mentorship for historically excluded racial groups as well. And so I will also answer questions during the panel. This is my contact information, so thank you again. But I also have the reference slide if you want to take a picture so you can find those toolkits. So thank you.